Good afternoon. This is Corey Partridge again. Today, I'm going to be going over the discussion one in the scenario of the car that hit the tree and kind of breaking that scenario down and discussing with you guys my thoughts on the call and what I think what they did a great job of and what I kind of noticed could have been done differently in my views. And then I'm going to answer the questions of describe the characteristics displayed by the paramedic at the scene. What aspects of patient care exhibited during this call might have not been there available or been available 30 years ago. So I'm just gonna go over it with y'all today and kind of share what I think about it. So it starts off saying you and your partner are met at 10:40 in the morning, are dispatched to a motor vehicle crash on Clear Creek Road. A bystander called it in saying a car swerved off the road through a ditch and impacted a tree. The EMR team is 10 minutes out, and your response time is going to be about 20 minutes. At that time, being a paramedic, I think with the nature of the call or the information of the call and the mechanism of injury with the vehicle accident, I think personally I would have went ahead and launched a helicopter at that time I was dispatched. Reason being is because if you get on scene and you don't end up needing it, you can just cancel it. You can get on radio and say, hey, disregard, return the helicopter back to service. We don't need it. But if you get on scene and the patient's a critical trauma patient or has life-threatening injuries, it's going to take you 20 minutes. If your response time was 20 minutes, and that's just from the ambulance station, not even saying where the hospital's at. It could be a longer travel time for you. That being said, like I said, with the severity of the call and the call notes, I would have went ahead and launched a helicopter. Time's critical in trauma patients, so that being said, that would have been my decision. The next thing I noticed, the EMR seemed like they got on scene and did a good assessment to their level of skill that they could do. They had C-spine stabilization of the 30-year-old male lying on the ground next to the vehicle. They were readying a C-collar and oxygen as myself and my partner showed up. So seems like they got a good for their scope of practice. They did what they needed to do. Says the EMR had completed an initial assessment and tells the paramedic that the patient is conscious, alert, and breathing. He is bruising to the chest and a large open wound, possibly fractured to the right thigh. To me, that seems like a good communication between the EMR and the paramedic of good patient rapport and of that patient. And so it also says the driver apparently got out of the vehicle on his own and collapsed due to leg injury. So at that time, the EMR told the paramedic, hey, this guy tried to walk, realized he had a fracture, collapsed. So we're going to go ahead and hold C-spine and hopefully the C-spine precautions. It doesn't say on here that the patient complained of neck or back pain. If he did, then the C-spine precautions would be good. I think due to the mechanism of injury, the C-spine precautions are good and need to be used. But I know with the new protocols coming out with spine boards and C-collars, that has changed a little bit. So hopefully it doesn't necessarily say in here that about the back pain, but hopefully they assess the patient appropriately and use those C-spine protocols as needed. And then it goes into the paramedic and his assessment and noticing that the patient's chest and the bruising with the difficulty breathing, as well as the open femur fracture. At this time, hopefully they had already started administering oxygen as needed, and had oxygen on that patient, because obviously the patient was in distress with his breathing. And then at that time, instead of waiting to get in the back of the ambulance and do some of the stuff like putting on, I think I would have went ahead and at least put him on the SpO2 monitoring and capnography, just with the difficulty breathing. Also, as a paramedic, I would have assessed his lungs at that point, because it's your breathing that's important. I wouldn't have waited, and it doesn't say he assessed lungs via listening. It didn't say this in the notes, but I would have at that moment as a paramedic. I noticed after I did my initial assessment, I would have listened to lung sounds to see if there was any kind of trauma possibly to the lungs, and then as you find out what his capnography is and his SpO2 is, get them loaded up. And then since they are waiting for the helicopter to come, because they dispatched it after, that's when you do, if you need to cut the clothes off, trauma naked, right? Get them packaged up, get the large IVs going, get them on the monitor, do a 12 lead if needed, do all the next steps. But it seems like they did a really good job with communication and teamwork. The sheriffs put the landing zone up, the EMRs assisted the paramedic and EMT as needed, with the traction splint and direct pressure of the wound. So maybe depending on the severity of the bleeding and where the break was at, maybe a tourniquet if you can't get the bleeding stopped. That wasn't necessarily brought up, but if it's the bleeding, you can't get the bleeding stopped, maybe use a tourniquet. So that was how I felt about the paramedic. And the communication, the assessment was good, and I'm sure hopefully he, based off not on the notes, but assessed the lungs with the stethoscope. But it seemed like there was really good teamwork, there was really good assessing. I think it went well. Like I said, I just would have dispatched the helicopter sooner. And then the second question: what aspects of patient care exhibited during the call might not have been there available 30 years ago? I don't think the helicopter may have not have been an option, because back then they were around, but they weren't as well known, and there weren't as many. So that may not have been an option, or if it was, it would have been maybe farther away. It may have been a lot farther away than, and maybe the scope of paramedicine, with it being a rural area, there may have not have been a paramedic ambulance service 20 minutes away. There may have not have been that one that close, because ALS and services are getting bigger and more common now, because EMS and paramedicine's more common. But back 30 years ago, your closest paramedic unit may have been further away. Obviously the equipment that we have now wasn't what it was 30 years ago. I'm not sure there was a traction splint, and I don't think there was necessarily a cardiac monitor, or there definitely wasn't a cardiac monitor that can do what the cardiac monitors can do now. So I think definitely equipment in this case is different, and the scope of practice of medical medical knowledge. I don't. There may, like I said, may not have been a paramedic unit that close, or probably not a helicopter that close, and maybe not a trauma facility that close either. It's all changed in the 30 years. So that's my thoughts on this discussion, and I look forward to hear from everybody else's opinions and their thoughts on what they think, how this call went, and what could have been done differently. Look forward to hearing y'all. All right, thank you.